Thank you, Brandon, and thank you all for joining us today for our 2017 webinar on one of the hot topics du jour, marijuana regulation. I'm Carrie Cork, a senior staff attorney at the Public Health Law Center and Tobacco Control Legal Consortium. We have several speakers and a lot to cover today, so I'm going to keep my opening remarks brief. I'd like to start by saying that this webinar is sponsored by the Public Health Law Center's Tobacco Control Legal Consortium, our national network of legal centers and attorneys that support tobacco control policy change at the local, state, and national levels. We do this by providing free legal technical assistance to tobacco control advocates, public health professionals, local and state health departments, coalitions, government, and private attorneys and individuals. Finally, our organization is committed to the principle that good public health cannot be achieved without addressing equity. So as I mentioned, I'm Carrie Cork, and part of my job at the Public Health Law Center and the consortium is to provide legal technical assistance on tobacco-related issues around the U.S. I'll be moderating and also presenting briefly on today's webinar. We have a fabulous lineup of speakers today. Our first speaker, Michael Tynan, is a public health analyst with the policy team at CDC's Office on Smoking and Health. Michael has been on the policy team from 2008 to 2013 and from 2016 to the present. In 2013, Michael left CDC and served as the policy director of the State Health Department in Oregon, where he worked on a variety of public health issues beyond tobacco control. He was also responsible for leading the development of public health regulations for marijuana while in Oregon. Michael rejoined the OSH policy team in 2016 and helped support states on policy issues regarding price, smoke-free, and point of sale. Our next speaker is Char Day, a program manager for Americans for Nonsmokers' Rights and the A&R Foundation. Char provides technical assistance, support, and training for states, coalitions, tribal sovereign nations, and public health advocates working on clean indoor air issues across the country. She's been involved in tobacco control for over 25 years. Char's background in the field of tobacco advocacy work includes passing youth access to tobacco laws, smoke-free campaigns, strategic planning with tribal sovereign nations, developing Native American tobacco curriculums, and advancing issues of health equity and parity within the tobacco control movement. And our last speaker is DJ Wilson. DJ is a lawyer and the tobacco control director for the Massachusetts Municipal Association, which is a nonprofit local government membership organization to which nearly all of the Commonwealth's cities and towns belong. The association provides educational forums for its membership and acts as a link between the municipalities and the state and federal governments. As Tobacco Control Director, DJ offers technical and legal assistance to municipalities on all aspects of tobacco control, and testifies at public hearings on tobacco control measures before local legislative bodies. He participates in the Department of Public Health Policy Committee on tobacco issues. So here's our agenda today. I'm going to give a quick overview of the current U.S. regulatory landscape of marijuana. Michael will then talk about his experiences with marijuana regulation at the state level, and also from a national perspective, some of the public health issues and dilemmas that policymakers need to face when marijuana regulation and tobacco control are both on the table. Char will then talk about issues related to the public use of marijuana and its impact on tobacco control as well as smoke-free laws. And we'll wrap up with DJ, who will share Massachusetts experiences in marijuana regulation. We're covering a lot of information this hour, but we're hoping to have time to respond to questions at the end. So as Brandon said, please send in your questions at any time by clicking on the Q&A button at the bottom of the Zoom window. So I'll just start by saying that regardless of your views on marijuana, if you think legalized cannabis, either for medical or recreational use, will never come to your state, well, we'd like to suggest that in all likelihood, that train has left the station. Your focus might be better spent figuring out how to regulate marijuana to ensure the lowest possible amount of harm to public health and safety. And why do I say this? Well, as I'm sure you know, 29 states and DC currently have laws broadly legalizing medical marijuana in some form. This includes the yellow and the orange states where marijuana is permitted in limited use, such as in cannabis oil, which is usually low THC. 8 states to date, those are the green ones, permit recreational marijuana, as well as DC. So roughly 63% of Americans live in states that permit medical or both medical and recreational use. And the marijuana regulatory systems in each of these states are very jurisdiction specific. As you know, in the US alone, retail cannabis sales are skyrocketing. They're estimated to reach over $11 billion by 2019 and over $17 billion by 2021. According to industry analysts, legal marijuana is the fastest growing industry in the US. And there's a bit of irony in this because, again, as you all know, marijuana remains illegal on the federal level as a Schedule I drug. Although it would appear that federal law is in conflict with any state law that allows marijuana to be used for either recreational or medicinal purposes, this area of law remains unsettled. There are several implications when you operate a trade or business or use a product in violation of federal drug laws, even if you're in clear compliance with state law. And I'm just give you an overview here. And then another difficulty with marijuana's current status is a lack of reliable scientific data and studies available on this product. Nevertheless, many medical professionals and researchers, including the Institute of Medicine, recognize that marijuana, primarily THC, the ingredient that produces marijuana's psychoactive quality, can be effective in treating a wide range of illnesses, symptoms, and conditions. In fact, earlier this year, the National Academies of Sciences, Engineering, and Medicine released a report that presented nearly 100 conclusions related to the health effects of cannabis and cannabinoid use. As far as therapeutic effects, the researchers found conclusive evidence that cannabis was effective for chronic pain in adults, chemotherapy-induced nausea and vomiting, and multiple sclerosis plasticity symptoms. The researchers found moderate evidence that cannabis was effective, as you can see, for improving short-term sleep outcomes and other symptoms. At the same time, the Institute of Medicine also acknowledges that smoked marijuana delivers harmful substances. So despite evidence of the benefits of medical marijuana for certain conditions, underlying public health concerns remain about its health risk. And with that, I'm going to turn things over to Michael Tynan, who will talk more about public health issues related to the product and its regulation.
Carrie, can you hear me?
Yes. Yes.
Great. So this is Michael Tynan, and as Carrie mentioned, I'm a policy analyst with the Office on Smoking and Health at CDC. I'm not going to have any slides. What I'm going to do is I'm going to walk you through, based on my experience, the issues the public health departments end up focusing on, and also look at the issues that state programs, specifically tobacco programs, should focus on. Because I don't have any slides, I do want to point out a disclaimer that's typically noted on our slides, that the findings and conclusions I make today are my own and do not necessarily represent the position of the CDC. So first of all, I want to sort of frame what I'm going to be talking about. I'm talking about laws in states which so far have all been ballot measures approved by voters that legalize the use and sale of marijuana. So those are the 8 states in DC that were on Carrie's map. I'm not talking about medical marijuana, which has been around in many states for decades. Something I often hear people say is, oh, no big deal, we've had medical marijuana for a long time in our state. But what I'm going to be talking about today is very different. I'm talking about a state allowing anyone over the age of 21 to be able to walk into a retail store and purchase packaged, marketed marijuana that's taxed, tested, and regulated for public consumption. And the products that I'm going to be talking about, like when we talk about legalizing marijuana, we're talking about a lot of things beyond marijuana plant material. So we're not just talking about dried leaves and flowers. If there's a consumer product on the market, you can probably put marijuana in it. And in many cases, someone in one of those 8 states has already probably put marijuana in some sort of version of it. And we aren't just talking about food items like brownies and cookies and mints and ice cream and salsa. Yes, salsa. We're talking about consumer items like creams, lotions, lubricants, suppositories. There are various versions of these products on the market that are available to consumers in some of those 8 states because they're in different stages right now, for an adult over the age of 21 to be able to walk into those stores and purchase one of these products with THC in them. There are also classes of products on the market like concentrates and extracts, which are sometimes referred to as butane ash oil or BHO. These items can vary and range from the types of concentrates that are used in electronic devices like e-cigarettes to a waxy-like substance that's heated on the end of the nail and then inhaled by the consumer. And these products are different because of the concentration of THC, which is the active ingredient in marijuana that makes you high, because they deliver, in some cases, up to 90% of THC to the user. So these are the kinds of products that we're talking about being on the market for any adult age 21 or over to walk into a store and buy a product that's been tested, regulated, marketed, and taxed for consumer use. So why should public health care about any of this? Public health department should care because, based on my experience, there's going to be a lot of work for you at the state health department, whether you get official authority or not. After voters approve a bill, what will likely happen next is the legislature will meet and put a bill together that operationalizes, for a lack of a better word, the ballot measure that was just approved by the voters. The way that these new products will become regulated and available to the public could be outlined in this bill. And typically, the kinds of things that get established either by the ballot measure or the legislature is a tax, public use, which I'll talk about a lot later, and I know Shar will talk about in her presentation. Public use can be addressed or even outright prohibited. Possession limits can be established. The ability in some states to grow your own plants at home may be allowed. There's the establishment for a state-based market for growers, distributors, processors, retailers, and something I'm not going to get into, but that Carrie mentioned, because of the interest of time, I'm not going to go into more detail, is that states will also pay attention to U.S. Department of Justice guidance, which is commonly referred to as the Cole Memo, which outlines topics like illicit trade and other issues that are very important to the federal government. So just to walk you through an example, what happened in Oregon was that in the underlying bill, public use of marijuana was prohibited in all public, so just public use of marijuana. You could not use marijuana in public. It had to be used in a private space. The Liquor Control Commission in the state was given the authority over licensing establishments. It allowed for the restriction of time, place, and manner of retail outlets, both by the Liquor Control Commission and by local governments. And the Liquor Control Commission was also given the authority over developing packaging for marijuana products. And they did this with close consultation with the public health department. For public health specifically, they were given the responsibility to come up with concentration and serving size of edibles. So how much THC should be in edibles and other products. Lab accreditation, so accrediting the labs that are going to be doing the testing, coming up with the testing standards for potency, pesticides, solvents, labeling. And while all of this was happening, I was involved in the public rulemaking process. And typically when you write a rule, in Oregon, you hold a rules advisory committee that meets once or twice. You post a rule for a public notice. You receive a handful of comments. You have a public hearing that's scarcely attentive at all. And after receiving limited public comments or limited, the public engages you in a limited amount, unless they're the regulated industry in most cases, and then the rule gets promulgated. We had a rules advisory committee that met on average 3 out of every 4 weeks from November to February for each month. So it met 3 out of 4 weeks of the month for November, December, January, and February. The room was packed to capacity with advocates and industry members. Our public comment period for these meetings lasted at least an hour or more for each meeting. And our public hearings were very similar. And this is because while it's important to look at it, we can look at tobacco for a guide on, in some cases, on how to address public use. It shouldn't be used one-to-one by any case. There are many things that are different and unique about marijuana that make it much different than tobacco, not the least of which is that, as Carrie mentioned, there are medicinal uses, some of which we now know have scientific evidence to support them. So the people who showed up to our meetings and were very loud and angry because they thought we were trying to take away their access to a medicine, which they believed helped them through chemotherapy, which we know is backed by evidence, or as they said in some public comments, they think it cured their child's leukemia, which we do not have sufficient evidence to support. And so as all of this is happening, it's hard for tobacco control to focus on what I think is the core focus that you should be thinking about, which is public use. This should be a priority for tobacco control programs. But the theme that I've noticed that happens in states is while the public is told during the ballot measure process, while they're considering voting for this bill, that public use will not be allowed, the minute the law gets passed, suddenly the dialogue shifts and you start to hear terms like, we have to come up with a public use solution. And what tobacco control programs across the country need to realize is that this is probably the greatest threat to smoke-free that we've seen in a decade or more. Public health and tobacco control programs, the public health community and tobacco control programs have to figure out where we are on a spectrum for marijuana use. Because right now, what's being passed in some states are a prohibition, supposedly, of no use in public at all. And what's being proposed in many states is to allow some sort of use, possibly indoors, possibly in establishments that are like bars or clubs. And this has moved forward in some communities. And I want to point out that just because public use is prohibited doesn't necessarily mean it isn't happening. I live in a state where marijuana use is legal for adults 21 or over. And I smell or am exposed to marijuana almost daily in my public and private life. When I walk my kids to school, when I walk my dogs in the park, when I go to the store, when I go to meetings near the state office building, I smell marijuana being smoked in public. So as people are pushed, as the public health community and public lawmakers are pushed to identify a place where people can use marijuana publicly, because there is no place for them to use it publicly, we need to identify and acknowledge that people actually are using it in public spaces anyway. And we have to figure out where we fit on the spectrum of allowing legal use and realize that the solution may be coming with or without us. So it's important for us to be at the table. And as I mentioned, tobacco control programs need to be focusing on this, but it's so hard to focus on it as all that other stuff I talked about before is sucking all the air out of the room. The other things beyond smoke-free that are appropriate for you to be thinking about, social norm change regarding youth and adult use, co-use of marijuana and tobacco, filling the research gap on the impact of lung health and heart health for smokers and non-smokers, and identifying the effects of secondhand smoke. These are all critical. These are also critical things for tobacco control programs and public health departments to be thinking about. And as we think about secondhand smoke exposure, we as tobacco control practitioners need to think less about the contact high question, the will you get high if you're in proximity to someone who's smoking, and think about, will this harm the lungs or will this harm the heart? And as we do all of this, we have to avoid reefer madness. We have to talk about marijuana in an honest and believable way that acknowledge not only the public health harms, but also the public health benefits and what we know and what we don't know. And so as I wrap this up, I want to also point out the surveillance and evaluation role. This should be a key and important role for health departments in addition to working on protecting smoke-free. And this work that you do around surveillance and evaluation doesn't have to start from scratch. There are a lot of great lessons learned from the states that have already legalized. There are work groups that exist from ASTO, the CDC Foundation, and others that have been convened for tobacco control program staff to work on this. There are groups that are already thinking about and have identified indicators on surveys like the council, or like CSTE. We have modules for BRFSS and the YRBS that have already been developed. So as you start to think about asking questions, you don't need to sit around and think up your own questions. It's critical for you to ask the questions that have already been developed, not only for consistency, but because they've been tested and we figured out what does and doesn't work. If you want more information about this, you can contact me and I can provide you with my colleagues like Jillian Schauer at the CDC Foundation and others who've done a lot of work on this. So my plug for surveillance is, if you think marijuana legalization is coming, you should ask questions now on youth and adult surveys on public use. If you don't think marijuana legalization is coming, you should ask questions now on youth and adult surveys on public use, because it is coming. If you think marijuana legalization is realistically coming for your state in 2018 or 2020, I hope you are already asking questions, because it is on the way and you need to have those questions and you need to have your baseline data now. So as I close this out, what I want to do is summarize a few points, and then I'll hand it over to Shar. So some considerations. It's really important to address public health concerns in a believable manner, and it's critical to avoid reefer madness. You have to realize that in many cases, you're changing the culture into a regulated industry, and this is a major shift from a group that's been either unregulated or regulated in a gray area for medical marijuana, that there's limited scientific evidence and research that's available today, not only on related harms, but on potential health benefits, and you have a role to play in filling that gap. We have to identify how many people are using marijuana, who's using marijuana, and we can't find ourselves trapped in pigeonholing everyone who uses marijuana as burnouts and stoners. There are professionals using marijuana. Your neighbors are using marijuana. I think you're going to be surprised to learn, especially when a state legalizes the cross sections of society that are using and accessing marijuana. And we also have to identify what impact legal marijuana will have on adult youth and youth initiation of tobacco and social norms around smoking in general. And then finally, as I've mentioned several times, it's critical to protect smoke-free protections that have been made over the past 20 years around keeping people from smoking tobacco in worksites, restaurants, and bars, and not changing social norms and sliding backwards. So with that, I will hand it over to Shar, and happy to answer any questions that you have later.
Great. Thank you, Michael. All right. So let me advance the slides here. Here we go. All righty. So what I'm going to be talking about is marijuana smoking and tobacco control. And like Michael had mentioned, its impact on smoke-free laws. So first, a little bit about Americans for Non-Smokers' Rights and American Non-Smokers' Rights Foundation. A&R, looks like my slides are still moving forward. There we go. Yay. All right, so A&R is the leading national lobbying organization that's dedicated to non-smokers' rights. And we've been doing this work at A&R for about, over 40 years. One of the main goals for A&R is to take on the tobacco industry at all levels of government, protecting non-smokers from exposure to secondhand smoke, and of course, preventing tobacco addiction among youth. A&R pursues an action-oriented program of policy and legislation, and ANRF, American Non-Smokers' Rights Foundation, is our training and technical assistance arm of A&R. So now, first off, here's a map of 100% smoke-free laws in the United States. We're really happy to announce that when the new lists and maps come out in January, I think on January 2nd, we'll have a few more cities to add, including Fort Worth, Texas, as of last night. Well done, Texas. So what I'm going to talk about is the health effects on non-smokers and what this means to smoke-free legislation. So currently, substance abuse prevention seems to be focused on consequences of individual use of marijuana and not on unwanted public exposure to secondhand marijuana smoke or secondhand aerosol from e-cigarettes. So a focus on non-marijuana smokers and protecting them from unwanted secondhand smoke exposure could create the same momentum that the non-smokers' rights movement saw back in the 1970s. Okay, but first, what we're not talking about, similar to what Michael had mentioned, what we're not talking about with this particular presentation is marijuana as medicine or personal private use. And also what I'm not talking about is brownies. So I'm not going to delve into the issue of edibles like brownies, but what we are going to talk about with this particular presentation is secondhand smoke from marijuana. So secondhand marijuana smoke contains hundreds of chemicals and many of the same cancer-causing substances and toxic chemicals as secondhand tobacco smoke, including 3 times the amount of ammonia, 3 to 5 times more hydrogen cyanide and significant levels, mercury, lead, formaldehyde, and all of that. What are the similarities between tobacco and marijuana? Well, I think it's pretty interesting there with the second bullet that nicotine and THC, tetrahydrocannabinol, both survive combustion. So when you light up a cigarette or a blunt that has nicotine or THC in it, that will survive combustion. Now that combustion creates carcinogens, and carcinogens then cause cellular destruction, which can lead to cancer. And that's some great research by Dr. Suzanne Schick in the previous slide. So now, secondhand marijuana smoke exposure. Well, secondhand smoke exposure from marijuana can cause very significant health issues. And it's important to note that there are fine particles in secondhand marijuana smoke. And these fine particles can be breathed deeply into the lungs, in the lower lungs. And that's where problems come from these particles breathe deeply into the lungs. They cause lung irritation, asthma attacks, an increase in respiratory infection, bronchitis, COPD, a lot of significant health issues. Now, the health effects of secondhand smoke exposure, we have some research that has been very helpful to the movement, where it shows that the secondhand marijuana smoke exposure in rat studies has been shown to impair blood vessel function. It has an even greater and longer lasting effect on these blood vessel function than exposure to secondhand tobacco smoke. So this is what we're starting to see in some of the research. And of course, we know that this on the right-hand side is a molecule of tetrahydrocannabinol, or THC. And that's the main mind-altering ingredient found in the cannabis plant. So long-term exposure of the workforce to the active ingredients in these smoked products could lead to some pretty severe health complications. Now, this is from Washington State, and Washington State legalized recreational marijuana via ballot initiative in November of 2012. And they have seen an increase in marijuana and work-related asthma incidents. So, and that comes from the dust of the marijuana plant, not from smoking marijuana, but from the dust of the marijuana plant. So this is why this is a health issue for workers. This is a worker health issue. And here are a couple of examples that come from the Washington fact sheet. But here in the middle, a marijuana processor developed breathing problems at work, and this was a 55-year-old female worker, and she developed asthma on the job, just from trimming marijuana leaves. And she didn't have ventilation, and breathing protection was not available, and that caused a big problem to her health. Now, we see a lot of myths, or we hear a lot of myths when it comes to the issue of marijuana smoke. And we'll talk a little bit more about that coming up. But like Michael says, it's important to have the facts to actually relate to these myths. One myth that I've heard, and a lot of people hear, is that, people believe they can strengthen their lungs to resist the toxic effect of substances. And really, there's no way to toughen your lungs. So, if you got a problem, you got to go see a doctor about that. Now, what does this mean to, we've talked about the health implications of marijuana for workers and marijuana secondhand smoke exposure, but what is marijuana's impact on smoke-free laws? And how do we overcome the perceived barriers? So what we're noticing is that the marijuana control movement is in a very similar place the non-smokers' rights advocates were in way back in the 1970s. And it may feel to you and to people in your state and communities that there's a seemingly uphill battle against a tidal wave of laws that are legalizing recreational marijuana. And how does that relate to our community's values? How does that relate to all the other laws and regulations we have? Well, one thing that we have noticed is that there is this connection with the marijuana industry to the tobacco industry interference tactics when it comes to smoke-free laws. From all these decades of fighting our adversary, the tobacco industry, we've been able to kind of collate some of the interference tactics. And there are quite a few of them. One's policy diversion, where we get weak policy language. And that just gives the appearance of doing something, but it doesn't really do what we want it to do. And with that too, is we've seen the policy debate try to be moved away from the health issues into something else like economics. Another one of the tobacco industry interference tactics is the third-party endorsers. And then the propaganda machine, where there's a lot of economic scare info from some of the marijuana industry that will lose sales and jobs and tourism if we don't allow people to smoke marijuana everywhere. And, so that's something that we need to combat with the facts. And then there's other tactics such as litigation and electoral activity. And this is one of those moments where you just have to look at all that money that Carrie showed us that's being made in the in the marijuana industry, and what the projections are for even more money in the billions. So what kind of impact does that have on electoral activity? Recently, the Imperial brand of tobacco named a medicinal cannabis expert to its board of directors. And this is just one more example of tobacco companies themselves moving beyond their traditional products to start to look at this amount of money that's being made in the marijuana industry. In Ohio, for example, the marijuana industry is still pushing for legalizing recreational marijuana and promising that it won't be smoked in public places. But as we can see from Colorado and Alaska and others' experiences, that smoking in public places is that second wave of lobbying that happens. I want to also mention that if you haven't already signed up to receive emails from the Marijuana Policy Project, you may want to do so that you can see how it's messaging, how the Marijuana Policy Project is messaging to its constituents. And that's just at www.mpp.org. So the Marijuana Policy Project, its mission statement is to gain influence in Congress and to change state laws to include marijuana. So it's really good to keep on top of that. Again, the marijuana industry is really pushing for people to experience vaporizing for marijuana or e-cigarettes use with marijuana. And a lot of the blogs and information that come from the marijuana industry promote the use of vaporizing. We'll see why that's such a problem too. And then we also, from Michigan, the marijuana industry has a campaign there. And initially they were trying to portray themselves as this local, campaign funded by idealistic stoners and medical marijuana users. But a campaign finance statement really showed that it was more the funding for this particular campaign was from profit-minded investors and corporate types, similar to big tobacco. So this is, again, another one of those issues where the marijuana industry is learning from the tobacco industry. So, of course, we see that it's a new industry, similar script, back where physicians used to promote the benefits of smoking cigarettes and also little ways to attract children too. So what is the goal of the marijuana industry? And I've heard this directly from their chief promoters and scientists, that their goal is to normalize marijuana use and to see it as normal as, quote, alcohol everywhere. So here's an example of a rideshare program that's looking to kind of get into the cannabis tourism as a rideshare piece. It's an example. And here's another example from Colorado, where you can have a bud and breakfast, like a bed and breakfast. It's a bud and breakfast, and we'll keep the bowl burning for you. So yeah, things are changing in our communities, and especially in Colorado. Even in my small town of Durango, Colorado, this is what we're seeing at the airports, these little tchotchkes here. So things have changed. There's no longer being known for, the atmosphere and the outdoor activities and the beautiful mountains. These are what communities are now being known as. So one of the other things we have is how marijuana is being disguised to look like vape pens or e-cigarettes. Now, if you saw this, would you know that this is for marijuana use? Well, I guess when you see the THC piece on that, but it's not very obvious. So THC oils and dry herbs are being inhaled via electronic smoking devices, and then that gets exhaled into the environment. E-cigarettes for marijuana are widely available, but the M-cig is different, they say. It's something of a hybrid between an e-cig and a joint, that you could put dry herb in it and heat it to the edge of combustion, and then that gets exhaled into the environment. So these are the states and municipalities with laws regulating the use of e-cigarettes in 100% smoke-free venues. And A&R strongly recommends that if your local or state law does not have e-cigarettes in it, that you get e-cigarettes added in as strengthening your smoke-free laws. And even with smoke-free multi-unit housing policies, we strongly recommend that these smoke-free multi-unit policies and rules also include e-cigarettes as a product that cannot be used indoors in smoke-free environments, and that way you will prevent exposure to others. This is something that we're seeing being promoted a lot, ventilation as the solution. When it comes to smoke-free laws, the industry is saying, well, let's be reasonable. Let's provide a solution. Let's just add ventilation to the law to allow for marijuana smoking indoors. And we all know that ventilation is not a solution. Matter of fact, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, ASHRAE, their board policy statement affirms that ventilation cannot eliminate all the health risks caused by secondhand smoke exposure. And they now base their ventilation standards for acceptable indoor air quality on an environment that's completely free from secondhand tobacco smoke, marijuana smoke, and emissions from electronic smoking devices. Let's see. All right, so marijuana smoking and policies and laws. Marijuana smoke is a form of indoor air pollution. So we need to defend the ground gained in the smoke-free movement and prevent rollback of smoke-free protections. We do not know enough about the long-term exposure of the workforce to these active ingredients in the smoked products. But from what we know already about the science, we need to protect non-smokers' rights from the negative health effect. People should not have to breathe secondhand marijuana smoke at work or in public or where they live. And that's why, it was great that Michael brought up us having these conversations about what does this mean for our communities now that marijuana seems to be everywhere, but people that do not want to breathe and choose not to breathe marijuana smoke should not have to breathe it. To protect workers in the public from exposure, marijuana smoking should be prohibited in all workplaces and public places. Now, this is a bill that is still in progress in California, Senate Bill 162, that looks at regulating marijuana like tobacco, and especially marijuana marketing. This is something we're seeing a lot of too, is marijuana marketing. This particular bill really looks at regulating the marketing of marijuana, very similar to tobacco. We'd also suggest use excise taxes for prevention and cessation campaigns. I think, I could be wrong, but I think Colorado is the only state that puts some of the funding from the taxes into prevention. There needs to be retailer licensing and additional zoning rules, but bottom line, prohibit marijuana use in smoke-free environments. So this is a map of all the laws restricting marijuana use in some or all of smoke-free spaces. And, so here's the good news. Back in 2014, there were 30 local laws specifically restricting marijuana use in some or all smoke-free spaces. In 2015, that doubled and a little bit more to 68 local laws. 2016, 143 local laws specifically restricting marijuana use in some or all smoke-free spaces. And as of this week, in 2017, there are 280 municipalities that specifically restrict marijuana use in some or all of smoke-free spaces. So the good news is that communities are going and strengthening their smoke-free indoor air laws to include marijuana smoke. I wanted to talk for just a little bit about Nevada, Colorado, and Alaska. This is one of the reasons why we have some of the issues going on in Colorado is that we do not yet have e-cigarettes added to the Colorado Clean Indoor Air Act. So therefore, people can vape marijuana indoors unless there is a local law that restricts it. So as of, I think it was this week, Denver had a Proposition 300, which would allow for social clubs or smoking indoors in Denver if it was a neighborhood approved smoking place. And so we had our very first application for this. It's the coffee shop called the Coffee Joint. And they're going to allow for vaping marijuana indoors in the coffee joint. But when when you see pictures of the coffee joint, there's a picture of someone smoking a pipe indoors. And, that's very different from vaping. So this is why we really need to strengthen our laws. And in Alaska, the Marijuana Control Board there is still working out its details for on-site consumption. And yet there's a strong desire to cater to the cruise line industry. Smoke-free advocates and public health educators have worked very hard to delay the rules for on-site consumption until after the state smoke-free law is passed, which will hopefully be by April of 2018. So the smoke-free advocates and public health professionals have gone out and they made presentations about marijuana secondhand smoke. And they've sent comments, hundreds of comments, to the Marijuana Control Board and submitted letters to the editor, all building a case for not allowing marijuana smoking indoors. And yet on this regulatory board, there are 2 marijuana industry representatives, and they have been known to call the shots sometimes, as you can imagine. And in Nevada, I wanted to mention real quickly that the Marijuana Gaming Policy Committee will begin to review this month whether the gaming industry can mesh with cannabis enterprises. So initially, the information from the Nevada governor and direction from him has been that gaming regulators have been clear on the prohibition of marijuana consumption on licensed gaming properties, but now they're wavering. And now he says there are additional policy considerations, he's saying, such as industry events and business relationships that should be contemplated when it comes to marijuana and gaming. So now they're going to start to discuss whether gaming establishments can exchange money with marijuana businesses, and whether they can host events that promote the sale, cultivation, and distribution of marijuana. And you can just imagine what that's going to mean for Nevada. And California right now is still working hard on the local level too, to try and keep these marijuana social clubs from opening without a lot of due thought. for what that means for their community. So Americans for Non-Smokers' Rights, in anticipation of what's happening with the secondhand marijuana smoke industry and how that affects local smoke-free laws and statewide smoke-free laws, we put together this position paper on protecting non-smokers from secondhand marijuana smoke. And there's some sample language in there. There's some information about the industry. There's some examples and case studies. So we'd love it if you wanted to download this when you get a chance. Now, we are hearing quite a few opposition arguments. I'll just touch on a couple of them. One is that we hear a lot that marijuana is natural and therefore cannot be harmful. That marijuana smoke is different from tobacco or not as bad or dirty as tobacco. There's not enough science, on and on. Just put in a ventilation system and all is good. And honestly, it's like we've gotten into this time machine and we rewound 20, 30 years ago. Because for those of us that have been in the movement for a long time, we've heard all these arguments exactly from the tobacco industry all those years ago. So we're going to hear more of these, and it's really important to have some very clear health and science-based responses to these kind of arguments. As another resource, we have a page on Americans for Non-Smokers' Rights with a lot of resources and links and fact sheets and infographics for you to use in your local efforts. So in conclusion, it's great to consider a campaign focused on non-smokers' rights versus an industry focused on profits over health. Include marijuana in your definitions of smoking and smoke-free laws. Be prepared for marijuana industry tactics. We can't be surprised by some of these tactics to push to expand legality, the push to normalize marijuana use, the absolute denial of any health concerns, and especially the push to weaken smoke-free laws to allow for marijuana smoking indoors. It's important that we stick to our health messages about secondhand marijuana smoke. And in the recommendations, we all know marijuana, legal or not, creates secondhand smoke, and secondhand smoke is a form of indoor air pollution. There is science about the particulate matter created by secondhand marijuana smoke, and there's science about the health effects of secondhand marijuana smoke, and more is coming. If we want truly to have safe, healthy, smoke-free spaces, then they should be devoid of particulate matter created by tobacco, cigarette smoke, marijuana smoke, and secondhand aerosol from electronic smoking devices. And of course, research demonstrates that ventilation systems are not the answer. This is not the solution. Smoke-free environments protect all workers and patrons from exposure to secondhand aerosol. So that's all from me. I hope we can maybe talk a little bit more after the next presentation. So I'd like to hand it off to DJ Wilson from Massachusetts Municipal Association.
Good afternoon, everybody. I have a lot of slides that go into the real details of the Massachusetts program that I'm going to skip through just for the sake of time. But let me first start saying I am the Tobacco Control Director at Mass Municipal Association. We are a trade association for mayors, city councilors, town selectmen, and town and city managers. 49 states, all states except for the state of Hawaii, have what are generically known as municipal leagues. I am the only person that I know of who works in tobacco for a municipal league, but all the municipal leagues dealing with medical marijuana or legalized marijuana are dealing with this as well. So it may be wise for you to check out your own state's municipal league's website, see what they're doing on marijuana, and maybe even call them and offer your services as someone who works in tobacco control. It is we serve 7,000 members, and we are oftentimes not put into the position of helping out on this public health issue. So the slides that are marked in the future for Mass Association of Health Boards, MAHB, come from Cheryl Savard, and I stole them from her, so I just wanted to let her know. So I'm going to blast through a lot of these slides and talk about some specific stuff dealing with tobacco. If I can make the slides go forward. So medical marijuana in Massachusetts was in 2012. It was properly put in the Department of Public Health, whereas legalization was not. And just as an indication as how slow Massachusetts has been on the careful playing out of getting medical dispensaries open, even though this was put in place 5 years ago, we only have 15 dispensaries currently for 6.5 million people. However, the recreational marijuana question that was put on our ballot last year was put to treat it like alcohol, which was very unfortunate because our alcohol, we have far, far, far more tobacco compliance checks than we do for alcohol. And one of the fears is that we're going to have this issue where in our cities and towns, the #1 age-restricted product that'll get regulated, the best will be tobacco, next liquor, and at the very bottom, marijuana. So the Cannabis Control Commission, CCC, has these 5 members, and they're the ones who are going to oversee this, and they have an advisory board that we have managed to get on. So we are there to speak for cities and towns. So if you work in local policies, it may be wise to make sure that your municipal league is also included in that. For funding mechanism, you can see that up to 20% can be taxed on this product. Our usual sales tax in Massachusetts, as well as the excise tax that was part of the referendum question. That 3% local tax is if the city or town wants to do it. I can't imagine a city or town not wanting that 3% local tax. So that is one of the competing interests here, is that you may have cities and towns looking forward to making some revenue off of marijuana. For local control, one thing that was in the question is that the number of pot shops per city or town can only maximize out at 20% of your liquor stores. So in Massachusetts, we have about 3,000 liquor stores, which means that we can have a maximum of 600 pot shops. That sounds like a ton of marijuana stores, but in reality, we have 850 tobacco vendors just in the city of Boston. So right now, the sad part is that additional money was just given to the CCC for cannabis control, and they now eclipse. They have about $200,000 more a year in their budget than we do for tobacco control, even though we are doing compliance checks and overseeing tobacco vendors far greater number. A lot of cities and towns have gone the route because they can legally as putting these marijuana shops into certain zones. And one interesting proposal out there that has not yet been passed in the city I live in is to limit all alcohol, tobacco, and marijuana sales to the 2 industrial zones in the city. It would be grandfathering those that exist, but of course that means there are none to be grandfathered for marijuana stores. So it would de facto put those marijuana shops in those 2 industrial locations. So I'm going to go right through a bunch of these, but these slides I'm sure will be on the website afterwards, and you can look them up. So here's where the interactions I with tobacco are. Number one, it has changed the world of drug paraphernalia for us. So before, we actually would have stores get a tobacco sales permit for the simple reason they can sell pipes, bongs, and then say, oh, these are meant for tobacco use. That is no longer necessary. So we will see an explosion of kind of head shops happen in Boston or in the whole state, and we won't necessarily know about them in tobacco control, whereas before we would be able to keep some track on them. The second problem is, here's a few things in here, is that retailers are coming to our tobacco people and our tobacco control people and asking, where do I get my marijuana license? We have recommended that they go straight to the police department, and a lot of these retailers won't do that, which is a good thing. As for we are not funded to work on marijuana control, all of our tobacco control people. So there is a lot of question as to how far we should be working on this, because people just equate tobacco with marijuana, and we're the first ones to get the call. We are, it is fortunate that we have probably the best understanding of the retail environment, and we do a lot of compliance checks and retailer education. So it makes sense, but we aren't funded to do it, unfortunately. So another issue that has come up, and Michael was talking about this early, is the public use. So the question was really poorly written, which is a pain for us because they want us to stick to it. But they actually did corner themselves into a corner that there's no place to have public use. So they are now talking about having these, marijuana use shops. But one recommendation would be our statewide smoke-free workplace law defines smoking as anything that can be combusted and inhaled. So that controls for the traditional smoking of pot. We also have 130 cities and towns that ban vaping in any place that is smoke-free by state law. So we will be doing some painful dancing with the industry over their idea that they need these places for people to go smoke pot or use pot because they can't do it in their apartments, at work, outside. And so that is going to be something I personally don't really care that, I don't care about their arguments because they should have written into the law. And then lastly, just we're working on this statewide bill, should get passed soon, and it will increase our minimum legal to the age 21. That does match the marijuana question. It will add e-cigarettes to the smoke-free workplace law, which further, instead of just those 130, but the whole state. So it will further complicate this need for a place to use marijuana. And that's it.
Okay, thank you, DJ. I appreciate your rushing through your slides, and I apologize to all of the attendees. We are out of time. I guess at this point we're going to have to wrap it up. If you have any questions, please do send them to us. We'll compile the list of questions that we've received and try to respond. We will have the recording and the slides on our website in the next day or two. So thank you all. Thank you particularly our speakers, Michael Tynan, Charday, and DJ Wilson. And please check our website at publichealthlawcenter.org for additional information and contact us again for further questions. Thank you all for attending our webinar.